Do you ever leak urine when you sneeze, cough, or laugh? Do you experience sudden intense urges to go to the bathroom? Do you have difficulty emptying your bladder? If you struggle with bladder control, you are not alone. More than 25 million Americans experience some loss of bladder control. Women suffer in silence approximately 7 years of symptoms before they seek treatment. Men are less likely to be diagnosed because they don't talk about their bladder problems. However, symptoms can easily be treated and managed with the help of healthcare professionals. Underlying health conditions such as diabetes, obesity, or urinary tract infection can be at the root of urinary incontinence. Every year nationwide, continence care costs taxpayers tens and tens of billions of dollars. Year after year, billions of disposable adult diapers end up in the nation's landfill waste, producing over 17 million tons of garbage, which accounts for 7% of our total waste. A disposable diaper can take up to 500 years to decompose. This situation is disastrous for the environment. The United States is behind in terms of prevention strategies. In 2005, 2 bills were introduced on the floors of the Congress, but both legislations died in congressional committees.
I'm continually amazed at how little people actually know about their own anatomy and how their body works and how it's affected. People also have to understand and get in touch with their own propensity towards risk as an individual. Because that is what helps them frame those expectations for outcome and helps them reach a decision about treatment choice that they can be comfortable with.
It was close to 20 years ago when I proposed thinking about urinary incontinence as a public health issue. We were coming at it in terms of how to contain urine and not really thinking much about how we could improve or even cure incontinence, make someone who was incontinent dry. And we were rarely thinking about preventing incontinence in the first place. And it's been very heartening to see how the professional community, especially in the International Continence Society, and of course Dr. Muller's organization, thinking about this as a public health issue and thinking about how we can do primary prevention through education and screening and so forth, and helping our consumers to become more knowledgeable. What I'm seeing in terms of policy is how can we promote this bladder health? How can we prevent problems? And if not totally prevent them, the rehabilitation of the bladder. One of the biggest things that health educators and healthcare professionals can do to help consumers make decisions is to stay updated on the latest research. And it leads into providing evidence-based information to people, not just about a disease condition or a condition, but about how their bodies function and how the bodies and function change over time with age. So that's some of the things that we need to take into account is to try to create this baseline level of information that people have. Many women don't understand how their bodies function.
patients or to consumers, I would say make your bladder and bowel health central to all of your lifestyle choices, because it is so fundamental to your freedoms and your quality of life. And to the caregivers, I would say get knowledgeable, be a part of the process, but also be patient and be supportive and play your part.
We are surrounded by people fighting bladder control issues. Let's initiate discussions and promote prevention and treatment. The bills of 2005 need to be reintroduced and sponsored. So interpellate your congressional legislators and remind them that bladder health and human dignity travel the same journey.